Hi, my name is Cynthia Leva, and I'm going to do a teaching plan over fall prevention. The World Health Organization 2021 explains a fall is defined as an event in which results in a person coming to rest inadvertently on the ground or floor or other level. Statistics. The World Health Organization, or WHO, 2021 provide this information. Falls are the second leading cause of unintentional injury and deaths worldwide. Adults older than 60 years of age suffer the greatest number of fatal falls. In the United States of America, 20 to 30% of older people who fall suffer moderate to severe injuries such as bruises, hip fractures, or head trauma. Prevention tactics. WHO 2021 educate strategies should emphasize education, training, creating safer environments, prioritizing fall related research, and establishing effective policies to reduce risk. Prevention is key because falls delay treatments and keep patients longer in the hospital. And I just strongly believe that education and training the staff that works with patients and also just patients themselves and understanding why they are high fall risks helps just prevent that itself helps prevent patients from falling because they are aware and we're aware that safety is a priority of our patients. Reasons fall occur. Patient's cognition status, if you are confused, unfortunately, you're automatically a high fall score because you don't know what's going on. Unfamiliar settings, not knowing where the call light is, cords and clutter. And this is like very important, when a patient is first brought to the hospital and they're just oriented to the room and the call light and know how to call for help when no one is in the room. Medications like narcotics, cardiac medications, or sedatives that may cause dizziness, confusion, and drowsiness. Not waiting for help to arrive. I know most patients, you call and ask for help, but then they get impatient or have to go to the restroom. Obviously, they don't want to wet themselves or dirty themselves, and they'll get up to the restroom before someone helps them. And lack of activity due to illness. This also leads to making patients weaker. You don't have your strength. You're going to fall. A fall score assessment that we utilize in our workplace. Each assessment factor gives you a point, and those points add up, and that gives you a score whether you're low, moderate, or high fall risk. And the assessments that we use are going to be age. If you're 65 and older, that's a certain point. Your fall history. If you've had a fall in the last 6 months, that's another point. Elimination pattern is assessed. If you're incontinent or have frequency, like due to diuretics. Medications, outside of narcotics, heart medications or sedatives like anticonvulsants, laxatives, hypnotics or psychotropics would also increase your chances of falling. Patient care equipment, IV tubing, Foley's, telemetry leads would also increase that chance. Mobility status, if your gait is unsteady, and cognition, once again, confusion. These would all add up to a score, and that helps that nurse assess what kind of intervention she needs to do for the fall precautions. Reasons patients fall continue. Patients fall do not just happen because of intrinsic factors like chronic illness or previous fall history, but instead patient falls are usually caused by multiple factors like nursing shortages, rising patient acuity, an inefficient work environment for caregivers, lack of hospital leadership to establish safe climate culture, and this is referenced by Way 2020. I just feel like he mentions very good points because I do strongly believe that the nurse's ratio to patients, if you have 6 and 3 of those are confused, but 2 of them are continuously trying to get up out of bed without help, that's going to increase a chance of a patient falling, unfortunately. The American Nurses Association has advocated for the Registered Nurse Safe Staffing Act. Although the national legislation has yet passed the law, some states have passed legislations designated to require the creation of unit-specific staffing plans and related policies and procedures. The states that have contributed to their own legislations to a specific nurse-to-patient ratio are Connecticut, Illinois, Nevada, Ohio, Oregon, Texas, and Washington. That's it there. What you can do to prevent falling. Call for help when you need to get up. keep items within reach and surroundings free of clutter, get out of bed slowly to prevent dizziness, assistive devices, turning on lights, and patients wearing non-skid footwear. These are all just very important and little things that we can teach our patients to do in order to prevent falling. The 3 steps to fall prevention is discussed next. The American Nurse Clinical Journal of 2018 discusses physiological falls caused by medical problems and symptoms can be prevented when patients and families are engaged in this 3-step process, which includes 1, fall risk screening and assessment, 2, a tailored or personalized care planning, and 3, consistent preventative interventions like universal precautions and tailored interventions to address patient-specific areas of risk. This here, the research suggests that the patient and family's engagement in the 3-step prevention process is critical because the independent patients at home do not believe they are vulnerable to experience falls in the hospital stay. So just educating them and like telling them, this is what you're here for. You're here for a syncope episode, and explaining to them, even though you're young and healthy and independent at home and you work, but you experience a syncope and you're in the hospital to figure out why you fell. This is your current fall score. So we want to do, bed in low position, side rails ×2 up, call it within reach, your non-slip socks, you'll be wearing a fall wristband, and a bed alarm just to remind you if you get up without calling for help, that'll alert the staff to come help you. And just explaining them and educating your patients that already has them in the mindset, okay, I want to follow these precautions here in the hospital so I don't experience another fall again. How to encourage nurses to reduce risk of falling. Whenever you're practicing your rounding and the 4 Ps, which is kind of universal, you discuss pain, positioning, possessions, and potty, following toilet plans, utilizing bed and chair lamps on high fall patients. That's going to benefit anyone. Fall alerts, you want to use your yellow bands, yellow socks, your fall bracelets, fall magnets on doors. This kind of alerts any staff member, whether it's speech, nutrition, your director, that this patient doesn't need to be left alone when they're up out of bed. And talking about recent falls and debriefing, we can, if you have a hub buddy that experienced a fall, then we can learn of how that situation happened and how to prevent that. And then it'll also prompt other nurses just to kind of do frequent rounding to prevent another fall from happening again. Kind of wanted to add on to that. The purposeful hourly rounding program was effective in decreasing the fall rates from an average of 2 to 0 falls per 1,000 patient hospital days for 2 consecutive months, and that was by Bell 2020. Just kind of additional research that shows that the 4 Ps and performing your rounding on patients and taking care of those immediate needs, going to the restroom while you're there, getting them their pain medicine after they go to the restroom, making sure they have, their call light, their water, all within their reach, and then making sure that there's no clutter around the patient if they do need to get up. This all just helps prevent those falls from happening when the 4 Ps and the rounding is being done every time you go into that person's room. Let's see here. New strategies for fall precautions and prevention methods. Some of the things I've seen and was reading about was like low beds that are just a lot lower to the floor than our standard hospital beds. So if the patient were to fall or roll out of bed or slide out of bed, the impact or injury wouldn't be as high. Sitters, and as a cost-effective method for hospitals, instead of actually having a CNA, they would be like a caregiver or a sitter is just beside the patient, giving them company and kind of keeping an eye on them for you while you're taking care of your other patients, and not leaving that confused patient alone just also is kind of one of the keys to preventing that patient from getting up and trying to figure out what's going on. And then stop, call, or help signs posted above the patient's bed or foot of the bed. If they're laying in bed all day, they have that sign posted right above their bed or at the foot of the bed that will just mention and say, hey, call for help before getting up. And I think those are just really good ideas that I've seen and was reading about that helps promote preventing falls. Medical physical restraints for confused and combative patients. The American Nurse Association 2020 discusses when patients are at risk of harming themselves through interference with their treatment or through impaired mobility or cognitive function. Nurses have a duty to act to promote patient safety when critical safety issues that cannot be resolved with other methods place patients at risk of harming themselves. Restraints are commonly used to regulate behavior when patients are disoriented or may injure themselves and should be used as a final option. Just reintegrating that restraints is the last, you want to start least invasive first, then, kind of use restraints as your last resort. If you do have a patient that's continuously getting up out of bed, pulling out their IV tubing, um, pulling off telemetry when they're there for heart issues, and you've already tried the sitter method and having someone stay outside their room and using a medication just to kind of calm them down, or a sleep aid, that's something that they take at home but that's just not being effective now. Restraints is an option. um, Accountability and responsibility for making nursing judgments, decisions, and taking action provide a safe patient care environment is expressed in provision 5. Just as nurses have a role in assuring that patients are safe and their autonomy is respected, nurses have a duty to themselves to assure their own safety, expressed in provision 4 of the American Nurses Association. So, we are covered to place restraints on patients as long as there's appropriate documentation and evidence that shows like this patient was confused and you were constantly in the room, and this was just a means to help keep the patient safe in that aspect. Or if you do have a combative and agitated patient that's unfortunately like withdrawing from a drug abuse or something, and they're throwing and kicking and swinging, then you need to use it so you're safe, your staff is safe from this patient. I just believe your documentation needs to be able to show that. But this would be another way to help prevent a fall, is if those extremes are needed, to use restraints. And then just conclusion, falls are an ever evolving issue for hospitals, and fall prevention and fall education to patients and staff members is the best way to prevent the fall from occurring in the first place. I just believe that we were experiencing a lot of falls in our unit, and trying to just regroup and kind of just read research and seeing what it is that causes falls and how we can go about preventing, and new ways to prevent falls in the hospital was kind of something that I needed. I can provide to my fellow coworkers, and hopefully just reach out to other people that may benefit from needing to look again at fall prevention and just making sure we're doing the right thing for our patients. It's kind of one of the reasons that led me to trying to pursue fall prevention for my teaching plan. And that's it. And then here are my references. I just kind of listed them. Hopefully you were able to catch them throughout my teaching plan. But thank you for your time.